Did you know that when you eat after exercise can create a 3x difference in muscle growth? World-class sports nutrition researchers conducted a 6-month, massive experiment with shocking results. The group that ate within 5 minutes of finishing their workout gained 278% more muscle than those who waited 30 minutes. The most devastating truth? Most people eat at the worst possible timing for muscle growth. What secret lies behind this dramatic difference? The scientific truth behind post-workout golden time. International sports medicine authorities conducting joint research revealed that muscle protein synthesis rates change dramatically based on timing after exercise. The first 45 minutes post-workout represents the absolute golden window for protein synthesis, and missing this window causes muscle growth effects to plummet. Leading medical university research confirmed that groups consuming protein within 5 minutes post-exercise experienced an average 89% increase in muscle protein synthesis rates. Meanwhile, the 30-minute delay group achieved only 32% increases. This difference occurs due to muscle cell state changes after exercise. When muscle tissue sustains microscopic damage from training, muscle cells enter a state craving amino acids and energy for repair. This represents the peak moment for nutrient absorption maximization. Hidden secrets of muscle synthesis mechanisms. Global medical research teams published meta-analyses revealing molecular-level mechanisms of how post-exercise nutrition timing affects muscle synthesis. Immediately post-exercise, the mTOR protein synthesis signaling pathway activates within muscle cells. This pathway peaks within 15 minutes post-workout and rapidly declines over time. Prestigious international medical journal research shows mTOR activity at 100%. 5 minutes post-exercise drops to just 34% after 30 minutes. More critically, insulin sensitivity changes dramatically. Post-exercise muscle tissue insulin sensitivity increases up to 7-fold above baseline, playing a key role in rapidly transporting blood amino acids and glucose into muscles. However, this elevated state quickly returns to normal levels, starting 20 minutes post-exercise. World-class research teams tracked how these physiological changes translate into actual muscle mass gains. 12-week experiments showed immediate post-exercise nutrition groups averaged 2.8 kilograms muscle gain versus 1.1 kilograms for 30-minute delay groups. Remarkable changes in 5-minute intake groups. Medical expert group analyses revealed the most noteworthy results were complex changes occurring in groups eating within 5 minutes post-exercise. First, muscle recovery speed accelerated significantly. Creatine kinase levels indicating exercise-induced muscle damage returned to normal within 24 hours, twice as fast as 30-minute delay groups. Second, exercise performance improvements proved more pronounced. After 12 weeks, bench press 1 increased an average 23% in 5-minute groups, versus 14% for 30-minute delay groups. Third, fat loss effects were greater. Despite identical exercise volume and calorie intake, 5-minute groups lost an average 3.2% more body fat. This occurred because rapid nutrition delivery increased muscle mass, thereby elevating metabolic rate. Unexpected problems with 30-minute delay groups. Internationally validated large-scale cohort studies revealed more shocking facts. 30-minute delays were not merely less effective but created negative side effects. The most serious problem was continued muscle breakdown. Post-exercise muscle tissue undergoes simultaneous synthesis and breakdown processes, but delayed nutrition prolongs breakdown phases. Global medical research analysis showed 30-minute delay groups experienced muscle breakdown, continuing an average 43 minutes longer. Second was dramatically reduced glycogen restorage efficiency. Post-exercise muscle and liver glycogen storage capacity decreases over time, with 30-minute delays showing 52% reduced restorage efficiency. This directly impacts endurance and power output during subsequent workouts. Third, prolonged inflammatory responses were observed. Exercise-induced inflammation represents normal adaptation, but delayed nutrition unnecessarily extends inflammatory states. Inflammatory markers Illinois 6 and TNF-alpha remained elevated and average 18 hours longer in 30-minute delay groups. Science of optimal food combinations and portions. Prestigious international medical journal research revealed the most effective nutrient combinations for consumption within 5 minutes post-exercise. The golden ratio of protein to carbohydrates is 13, consuming 0.25 grams protein and 0.75 grams carbohydrates per kilogram body weight optimizes both muscle synthesis and glycogen restorage. For example, a 70 kilograms adult requires 17.5 grams protein and 52.5 grams carbohydrates ideally. Protein type matters significantly. Whey protein demonstrates fastest absorption rates, reaching peak blood amino acid concentrations within 15 minutes, when consumed within 5 minutes post-exercise. Casein protein absorbs slowly, failing to fully utilize immediate intake advantages. High glycemic index carbohydrates prove advantageous. Glucose, maltodextrin, and bananas effectively enable rapid glycogen restorage. World-class research team clinical trials confirmed high glycemic carbohydrate consumption within 5 minutes. Post-exercise accelerated glycogen restorage speed by an average 89%. Practical implementation guidelines. Medical experts universally recommend pre-exercise preparation for actual application. Achieving within 5-minute post-exercise consumption requires food preparation before workout commencement. The most practical method involves preparing simple snacks. 30 minutes pre-exercise. 1 banana plus 100 grams Greek yogurt, or 20 grams protein powder with grapes represents ideal combinations. These foods remain shelf-stable and enable rapid consumption. Adjustments based on exercise intensity and duration prove necessary. Post-high-intensity resistance training requires increased protein ratios, while endurance exercise benefits from higher carbohydrate proportions. International Society of Sports Nutrition guidelines allow increases to 0.3 grams protein and 1 gram carbohydrates per kilogram body weight for sessions exceeding 60 minutes high-intensity exercise. Liquid nutrition delivery proves superior to solid forms. Protein shakes and sports drinks require less gastric processing time, enabling faster blood nutrient concentration elevation. Global medical research team analysis showed liquid consumption averaged 34% faster absorption versus solid alternatives. Age and gender differences. World-class medical researchers discovered that post-exercise nutrition timing importance varies by age and gender. Males in their 20s demonstrate highest mTOR activity levels, showing the most dramatic 5-minute versus 30-minute consumption differences. This age group achieved 156% higher muscle synthesis rates with 5-minute consumption compared to 30-minute delays. Adults over 40 show reduced but still significant differences. Prestigious international medical journal research confirmed 40 to 50-year-olds still demonstrated 78% higher muscle synthesis rates with 5-minute consumption. This occurs because declining protein synthesis capacity with age increases optimal timing importance. Females experience hormonal influence variations during ovulation phases. Estrogen enhancement of protein synthesis amplifies immediate consumption benefits. Postmenopausal women demonstrate patterns similar to males. Exercise type specific optimization strategies. Internationally validated large-scale cohort studies presented optimal nutrition strategies based on exercise types. Post-resistance training benefits from increased protein ratios, particularly after high weight, low repetition exercises, causing significant muscle damage. Protein increases to 0.4 grams per kilogram body weight prove beneficial. Medical expert group analyses reported enhanced importance of 5-minute consumption in these scenarios. Post-cardiovascular exercise requires glycogen restorage focus, rapidly replenishing glycogen depleted through prolonged cardio demands. Immediate high glycemic carbohydrate consumption. World-class research team clinical trials showed post-marathon 5-minute carbohydrate consumption achieved 95% glycogen recovery within 24 hours versus 73% for 30-minute delays. Post-high-intensity interval training benefits from balanced protein and carbohydrate consumption. HIIT incorporates both strength and cardiovascular elements, making the 13 golden combination most effective. Common real-world mistakes. The most frequent mistake observed in actual exercise settings involves prioritizing post-workout showers and cool-downs. Global medical research team surveys revealed 83% of typical gym users consume food more than 20 minutes post-exercise. Second mistake involves drinking only water post-exercise. While hydration remains important, this alone cannot supply nutrients necessary for muscle synthesis. Prestigious international medical journal research confirmed water-only consumption groups experienced muscle protein breakdown, continuing an average 67 minutes longer. Third mistake involves excessive protein consumption. Believing more protein equals better results, some consume 2 to 3 times necessary amounts, actually increasing digestive burden and reducing absorption efficiency. Global medical research analysis showed protein consumption exceeding 0.5 grams per kilogram. Body weight actually decreased muscle synthesis rates 5 minutes post-exercise. This small change will completely transform your physique. If this video helped you, please subscribe, like, and hit the notification bell for more evidence-based fitness content.